thank you all for coming. I'm Jeff Cohen, one of the founders of AIVA, and Autumn, my partner, one of the founders of AIVA, Autumn Piccolo. I'm not used to that, but that's who she is for purposes of today. Anyway, I want to thank you all for coming and just take a moment to kind of frame why this is special for us. AIVA, as you know, was formed to be the beacon of excellence in the IV hydration industry, to put together what you need to get into business and also to stay safely in business. We always say the healthcare business is, especially the IV hydration business, is easy to get into, but it's not easy to stay in. So we want to make your investment of time in your education, and we want to make it very worthwhile, and we want to help you stay in business and stay successful. This event is really interesting to us and very groundbreaking because we noticed that the media and the regulators are doing their best to do what they do, provide transparency, honesty, and to create safety for the public. And they're doing it in a vacuum because the industry is emerging. And as it emerges, regulators and media try to catch up with it. And they're doing the best they can, but there's nobody out there saying, let us help you. Let us connect you with key opinion leaders. Let us give you insight and information that you can't otherwise get. They're going to be shocked today to find out that there are physicians that are absolutely experts in IV hydration. They're going to be shocked to find out today that there are clinicians who dedicate not just their time to IV hydration and wellness, but all of their educational efforts deeply into that space. They're going to find out that there are businesses, Sarah Lomas and Sam Tejada from Liquivita, they're going to find out, and Ben Crosby, there are people here, and all of you, Felicia and Katie, that are so dedicated to the science and the data collection and the informatics and the analytics that there's real numbers here. And that's what AIVA is about. AIVA is about really putting hard science together with anecdotal data. It's not just, it made me feel better. It's not just, I want this. You know, the idea that IV hydration can be offered in a juice bar manner, driven by patient demand. We understand the dangers there. We understand why science needs to balance that out, why clinical guidance and oversight and direction and control has to be at the forefront of the industry. And that's what AIVA is about. And today I'm excited that the media and the regulators get to meet some of the leaders in this industry that are committed to real outcomes, real science, and real positive impact on health. You know, there's this idea in the professional association world, whether it's hospitals or physicians, that the media and regulators are our enemies, and that we need to hire lobbyists and try to create rapport, but push, push, push. This is a very different approach. We realize that the media and the regulators have a very important job in our culture, in our society, that there are partners. And for that reason, AIVA's intention and commitment is to build a bridge, to serve as a conduit of value. Everybody in this industry is a caregiver, everyone. They want to help people, they want to make a positive impact. AIVA wants to do the same thing with the media and with regulators. So thank you for taking your time. It's going to be a very interesting morning. I'm excited about it. We all know a lot of the folks here, and terrific people, fantastic leaders in their industry. Autumn, so sorry to step on your time, but
no, we're good. Thank you, everyone. I'm giving the sentimental note, which is that when we started AIVA a couple years ago, we didn't know if the industry wanted it, and the industry wants it, and everybody has donated their time and stepped up to make sure that the industry has a voice and is taken seriously. And so pat yourself on the back for that. We appreciate you being here. We've maxed out our live stream registration. So there's thousands of people tuning in kind of nationwide now, and it's going to be a great day. So thank you guys.
thank you.
We're kicking it to David now.
David? Thank you, man. Appreciate it.
Good morning. David Light, COO of AIVA. Thanks, Autumn and Jeff, for that introduction. We've got a power-packed agenda today. I'm not going to go through all this, but you'll be excited as we walk through this with some of the speakers actually zooming in from across the world. And this is our first in a series of events. So a few months ago, we really set out on our 2024 strategic plan, and it's starting to kick in high gear now as of today. So we've got this event, and then we go through a summer series of webinars with some of the key industry leaders in this room. Then we cap with a VIBE conference, the VIBE conference, which is the official conference of AIVA in Boston, September 8th and 9th, which again is going to have a significant amount of industry leaders, people outside the space in healthcare, and excellent speakers from that regard. So that'll be really wonderful. And then we're going to do this again in October, another media day. So we've got a Power Pack 2024, all of that benefiting the entire IV hydration industry and being led by the people in this room that I want to take a few minutes and just kind of go through on how this is all possible. So we have two significant groups of committed companies that support AIVA. And what I mean by that is they support AIVA with their time, effort, energy, wisdom, and dedication to the industry. The first group is the key vendors. We've got more than a dozen of those from across the country in multiple different service industry lines that support the industry. I'd like to, a handful of them are here today, from a variety of different, methodologies that they follow, but we've got marketing, we've got insurance, we've got nutrient supplement, we've got labs, we've got pharmaceuticals, and entrepreneur-based and medical guardian and guidance as well. So that's awesome. And I'd like to thank Creative Click specifically for helping with all the social component and also putting this presentation together. And then most important, we've got our founding members. So this is a group of people that have come together, led by the Leadership Advisory Board, which is basically Sam Tejada from Liquivita, Ben Crosby from Drip Bar, and Sarah Loomis from Revive, that are part of the founding members. They're on the Leadership Advisory Board as well. But we've got Felicia, who's here in person from Live. We've got Katie here in person from Hydrate IV Bar. We've got Shane from Hydrate, IV Mobile Medics. We've got IV Nutrition. Jason's here. Mobile IV Nurses, Liquivita, Drip Bar, and Revive, again, are an important part of that as well. And I'm going to kick it over to Sam Tejada, who is the chairman of the Leadership Advisory Board for AIVA, to give us an update of a kind of state of the union of the IV hydration industry. Thanks, Sam.
Good morning. A lot of beautiful people here. Appreciate you guys making the time to come out. So my goal here is to kind of talk about the mission of the American IV Association and what we plan on doing. So the American IV Association plans to unify, shape, and protect the IV hydration therapy industry safely and sustainably. How are we going to do that? By creating that one strong voice. By all of us collectively getting together and pushing this agenda forward. The American IV Association is composed of a diverse group of powerhouse wellness experts, academic professionals, and industry leaders. This board is poised to redefine the boundaries of excellence in the IV hydration therapy industry. The Leadership Advisory Board. As David mentioned, Leadership Advisory Board has myself as the chairman, has Ben, and also Sarah. So the role of the Leadership Advisory Board is to help lead the way and utilize our influence to give the industry what it needs. We have also made it our priority to centralize and disseminate information as it comes in. We have developed specific committees for oversight, data, quality assurance, and compliance. Few little fun facts. I decided to do a little research on some statistics that are out there that I want to share with you guys. According to researchers, IV therapy has been found to be part of the top 5 wellness trends around the world. Top 5. Think about it. A study published in the Journal of Alternative and Complementary Medicine found that IV therapy can help improve energy levels, reduce stress, and boost immune function in individuals with chronic fatigue syndrome. According to a report by Allied Market Research, North America is the largest market for vitamin IV therapy, accounting for over 40% of the global market share. This is due to the increased popularity of wellness treatments and the presence of key players in the region. 40% in North America. What does that mean to me? We have the ability to set the standard for the global footprint. And there's people here in this room that are already doing that. A study published by the Journal of Clinical and Aesthetic Dermatology found that IV therapy can be effective treatment for skin conditions such as acne, eczema, psoriasis, as it helps to improve skin hydration and promotes collagen production. So I want to talk a little bit about the landscape of the IV hydration industry. When I look at it, it's really divided into three main parts. You have the tourism, people that are dehydrated, people that are the party goers that are hungover, right? That they're looking to boost themselves back up. You have the wellness side, which is more of the prevention, lifestyle medicine. And then you have the functional medicine component, which based on data shows that it's a good 50% of what's happening with IV hydration. That's treating chronic illness and disease. Our industry has been under scrutiny by certain governing boards, which include at the state level, federal level, and also other associations. So there's no other way that I can put this but say that we're under attack, right? Unfortunately, most of these issues we are seeing are all based on pure ignorance. We have people in decision-making roles that just don't understand our industry and are making assumptions with minimal data and facts. This is where we're going to come in and show them differently. Our goal is not to put up a fight, but instead work with them closely and educate them on what we are doing and provide the scientific data on how this is truly benefiting the patients we are treating. But at no point, how I say, get it twisted. We've developed something, we've worked very hard, and we have a lot of patients that are benefiting from what we're doing. And if we have to put up a big fight, I will. All right. Our goal is to put up, the goal is for us to embrace what we are doing and work together to serve the patient population that is in need of these treatments by making sure we are providing these treatments in a safe and effective manner. There's both a lot of subjective and objective data to support these claims that we're making. I'll let the scientific advisory board comment on that shortly. Our goal is to have American IV Association certification process for both clinics and providers to make sure they are following all proper guidelines for safety and efficacy of IV administration. The bad apples. Let's talk about the bad apples. As you guys know, in any industry, there's always going to be a few bad apples in a bunch, right? People are just going to try to fill up their pockets with money, right? As the American IV Association, we're not going to allow our industry to be the Wild Wild West. Our established standards will hold those individuals accountable. Our training curriculums will provide continuing education units for medical providers to further understand safety and the treatment protocols. We are working closely with Revive Global, which has designed a virtual accredited training platform called IV Pro, which provides this type of education. This is a living, breathing thing. It's continuously being updated as more research comes out. So in conclusion here on my end, there's a long road ahead of us. But taking these initial steps is leading the industry in the right direction. It is truly up to each clinic, each medical provider, and even each IV hydration patient to come together and be that one voice to lead this industry forward. Thank you.
This is the regulatory compliance part. Here's what I'm not going to do. I'm not going to lecture you about what's happening in each state. We know what's happening in each state because part of the responsibility of AIVA is to collect that information and share it with you. We track it. We also track it in the law firm because we're handling a lot of those issues, whether it's a BOP issue or a board of nursing issue or a board of medicine issue. So it's very dynamic. I remember when we first got started as an organization, we said, you either define quality or quality is going to get defined at you, not for you, but at you, because it's going to be defined by people who don't have your education, training, and experience. And so we're seeing a lot of interest around the country and around the world as what's going on there, and is it okay, and is it safe, and is it doing good stuff? If you want to find out the details of what's happening where in real time, contact David at AIVA. He'll provide it to you. We have that information. What I want to do today is have a conversation with somebody that everybody knows and loves, Felicia. Felicia's a franchisor. She's a clinician as well. She has a very strong leadership role, like many people at this conference do for AIVA, where they're donating a ton of uncompensated time out of the goodness of their hearts because they know that this industry needs and wants leadership. And so she's one of the leaders on the leadership side of the organization, on the scientific advisory board, and a terrific resource. I thought it might be fun and useful for those of you who are here and watching, media, regulators, clinicians, to see what a conversation about regulatory issues might look like between somebody who advises that space and somebody who occupies that space and takes care of patients. So if that's all right with you, that's what we're going to do. Does that sound good? Cool. Now, from a microphone perspective, because I don't know how this works technology wise, are you going to be able to hear us if we have a conversation? Good? Cool. Great. So Felicia, what kinds of issues are you dealing with on a regular basis or that come up, and how are you dealing with those in your clinics?
Yeah, so a lot of the things that we deal with are some of the nursing staff. So nurses worked really hard to get their license. As not only a business owner, but a franchisor, we want to make sure that they feel safe in our stores and our different clinics and offices and workplaces. So helping them recognize, who are we working with, like law firms like yourself, making sure that we can explain to them, those consents you signed at the hospital and those doctor's office, we are using the same. We have those, the H&Ps, the health history, the medical directors, we're doing those same things and helping them, bridge the difference in environment, I would say. We're really used to, it's okay to hospital or surgical center, doctor's office, but helping educate those nurses that we are for you. This isn't, this reckless underground clinic. We're doing these things and we're working with really, really experienced and educated people to help bridge that. Now, if you are not working for clinics that are like that, then, I can't vouch for everyone. I can vouch for those in this room, but that is it. You need to make sure that you're looking at those regulatory items and are you following your nursing license?
So you've got the nurses that come from very intensive clinical backgrounds.
Yeah.
They're working in hospitals, they're working in skilled nursing, they're working in surgery centers and what have you. A lot of them migrated out of those centers during COVID because of the stresses and because of the fear in those environments. Are you finding a cultural integration that has to be done in the wellness space so that they can understand wellness and understand that the same kind of clinical protocols they followed in those intensive environments have to be kept in the IV clinics that you guys have?
Yeah, absolutely. We have, it's interesting overall, the safety in our industry, we have the data, right? This is a very, very safe, you and I have talked about it compared to other things that are going on, like we just done right with the right technique, with the right professional, it's very, very safe. That sometimes can lead nurses to that there's not as much risk in this. So making sure they understand what is an incident, that those are still getting reported, that we're still communicating to our medical director. There could still be med errors. You have to talk about these things, making sure that those same processes, those same safety measures, and we're getting that data, because that data is how we then can come together and say, you know, this is what happened. How can we put a process in place to make this even more safe? It isn't, this is safe. There's been very few claims in this area, you know, adverse effects, if you will.
Right.
So we don't need to worry about that. No, our board and our advisory and the stuff is, we're like, let's get all the data together. Let's make it even more safe. Let's make it even better for the clients, and helping the nurses understand that those processes, even in this center, are, you have to do them. It isn't anything different than if you were at a hospital.
You know, clinicians, we've talked about this many times, are accustomed to following a certain protocol. They speak with the patient, so they examine, prescribe, treat, and document. And they follow that protocol in any environment that they're in, whether it's a hospital or an IV clinic. One of the challenges that I think that the regulators and the media have is the notion that maybe that protocol that attaches to somebody's license is not being followed in IV clinics, because IV clinics are sometimes owned by business people, not clinicians like yourself.
Okay.
So what I think you're saying is that that protocol that they're used to following is something that is culturally woven into your business model.
100%. I mean, as an ER nurse, as a nurse that worked in a surgery center, do you know how many times I've had to give pain medicine without the doctor on site? I'm allowed to, right? In my scope of practice, if somebody's 10 out of 10, the provider isn't there,
Yeah.
I'm allowed to give that. That is my nursing license. I'm educated. I can assess patients. I can look at these things, and I'm allowed to do that. And my nursing board in Nebraska says you absolutely can.
And I think that's one of the areas where regulators and the media and the public are a little bit questioning. It's like, well, what is the scope of practice of a nurse's license, of an NP's license, of a PA's license? And should they be able to do certain things like prescribe IV hydration or administer it?
Yeah.
And those kinds of questions are absolutely understandable.
100%.
And I think it's on us as an industry, and as you as a business person who's also a clinician, to help both your staff and the patients understand that you're following a track that's been laid out for you by your licensing board.
Vocabulary is everything. You know, you can use the wrong vocabulary, and I don't want to say wrong, let's say different vocabulary. I do not, you know, prescribe medicine. I'm a nurse, I'm an RN. I do, however, have the ability to assess and administer medication per clinical implications, you know, pain, fatigue, different things, dehydration. And that is what is so important. So when I hear nurses saying, you know, I prescribed an IV, I'm like, oh dear, no, you did not. And you should, like, you can't, like that. I think it's not that they are doing, I don't think they fully understand the vocabulary sometimes. So then it gets out there and it's used in the wrong context, and then it kind of spreads. And so really looking back, and it's happened in my own clinic that I have to recorrect the vocabulary. So really making sure we fully understand, do they know the power of that word? And so we really stress, you know, you're administering, you know, we definitely aren't creating super, you know, vitamins in a back room. You know, I'm getting them from, you know, very qualified, you know, pharmacies that do third-party testing, and I am administering them based off of orders that are in my store. So I think there's some of that too, like you said, just explaining that to not only the nurses to help them understand what they're doing, but also those that are hearing, you know, asking the question before making an assumption, saying, you know, oh, are you really, or is there a medical doctor there, or is there a provider? No, there is a provider there. So you're not really prescribing it. You know, asking a couple more questions can really help get to the truth, and to make sure, because really what we're doing is we're worried about patient safety, right? This whole thing, all these issues, or, you know, kind of pushback that I feel our industry gets is for the good. Like you said, they're worried, they're scared, rightfully so. You know, the first person that did open heart surgery, I'm sure not everyone was like, this is a great idea. You know, at a certain point, somebody's like, they're nuts, you know, but look how many we do now. Look how much safer we got. And I just think that it's because it's new that we need to help educate on that area of what we're actually doing
Right.
in these clinics because they are following standing orders and they are using safe products that are in a lot of our hospital systems and doctors' offices currently.
When you have a nurse that comes in from a different environment that might not have the kind of experience in IV hydration or understand the clinical issues associated with it, the risks, the benefits, and what
Yeah.
have you, what kind of support, educational support, do you guys provide your staff?
Yeah, so honestly, the technique of starting an IV nursing school, then, some people don't have it. So that's one thing. They have never started an IV just because your nurse doesn't make
Right.
you know how to start an IV. So making sure you watch over and making sure they know how to do it properly. There's some surgeons don't know how to do an
Sure.
IV. They can, doesn't mean they should. So
Right.
really making sure you have the right person with the right experience in there is number one. Number two is then using different resources. Some people, there isn't a Davis drug guide with our stuff in there, unfortunately, right? Like I can't look up the compatibility. So making sure we're being really safe and understanding the vitamins within themselves and how they should be used. Our amazing pharmacy like Olympia is great at their pharmacists have data upon data of what these are used for and making sure you're giving that to your nurse so that they are making well-educated, administering things safely and how
Yep.
they should be.
I think one of the concerns that the industry has, regulators have, the media have, and you have as providers, is the notion that patients can get in and direct and control their care. And I know, with the media, I think that with the internet, excuse me, it becomes even more of a challenge because anybody can Google anything and think that's for them, right? I need that because I Googled it. And I'm sure you have patients that wander into your clinic from time to time trying to tell you as a clinician or your staff as a bunch of clinicians what to do and how to do it.
Absolutely. So it's a fine line, right? Because I was taught in nursing school, which I think sometimes we got far from, is you should listen to the patient. The patient is the boss. It is their body. Their body is completely different from person to person. I give you vitamin C, I give myself, and I give Sam. It's going to act differently. Like that, the only constant there is the vitamin C. We're the wild card. So it is super important to listen to the patient. If we're taking that out of medicine, we have a whole different problem, not just in IV therapy, but all across the board.
Yeah.
So I think the notion that the doctor knows everything, I love physicians. They're brilliant. But if the doctor isn't asking questions, I can say I'm tired and you can say you're tired. Are we both tired for the same reason? Do we both need the same thing? Are you tired because you can't fall asleep? Or am I tired because I'm stressed?
Right.
Like you can't just say, are you fatigued? Yes. That doesn't even answer the question. It doesn't even begin to get to the root problem. So yes, I do believe we have to get as much detail from the client. And if you came in and said, I really need vitamin C because I'm tired, I'm not going to tell you you're wrong because what if you're immune compromised? You're dang right you need vitamin C and that will give you energy.
Yeah.
So it is super important to ask these questions. And I think where we need to correlate some of this stuff, and I use this analogy a lot, but if I wanted to go and get liposuction at a plastic surgery center, they would put me to sleep, I'd get fentanyl, and they would do it. Why is allowing someone to boost their immune system, replenish their vitamins, and help detox from all the chemicals seen as bad?
Right.
I just think I don't have any judgment on that because we are humans and we should be able to decide, but they need to have the education. If I go in at 130 pounds, I hope the surgeon's like, you know what, maybe we could do some exercise. You don't need liposuction today. That would be on that surgeon, correct?
Yeah.
Like to educate. It is the same thing that the providers in our offices and the staff is the same thing at the bedside. If I'm helping a new mom that just had a baby and she says, I want a bunch of fentanyl because I'm in pain, probably be like, you know what, that's going to probably put you to sleep. Not going to be great for baby, probably. And let's do some Tylenol. Education.
Clinical
I'm not just
leadership.
going to do it,
Yeah.
right? They have a line. And so it's really just helping them understand that we are practicing the same. I sometimes say it's like we're institutionalized. Nurses will come from one hospital and say, well, that's how they told me. I'm like, who's the we? Because if I go to one hospital system, I go to another as a nurse in the ER, I promise you I have a different protocol.
Yeah.
And if I swapped them, somebody from the top floor is coming down to yell at me. So
Right.
I think it's just super important to understand that we're not just out here like playing chemist.
Well, to that point, let's talk about the issue of physician involvement in these clinics, because I think a lot of the assumption that lay people, lawyers and public and folks in the media and regulators sometimes have is that quality is more assured and predictable and sustainable if a physician owns it, if a physician is physically there and that sort of thing. And my personal experience over the last 37 years of being a healthcare lawyer representing physicians and medical practices all over is that they stay in their lane. They have mastery over a certain thing, and that's where they do. And many of them haven't dropped the line into somebody since med school. And then you get guys like Sammy, who was firefighter and paramedic, and he could drop a line to somebody on a gurney out from a car accident.
Right.
So, that idea that it'll be better and more secure and more predictable quality if a physician is somehow embedded into the business model of one of these clinics, I find that a very interesting topic, and I'm curious to know what you think of that.
I would say one, I would hope that they wouldn't assume that they're not, right? They have to have an autonomy of medical direction somewhere. If not,
Yes.
again, that's not the clinics we're talking about here. But they are in there. I think I worked for many surgeons, I worked for many physicians, and I will tell you with 100% certainty, they wouldn't do it without me or a nurse or a receptionist. They're not answering the phone. They're not making their business decisions. They don't care what was ordered from McKesson. They care that it was the blue one. To think that the doctor being involved necessarily makes this safer, I think that's a scary tool too. Like that would be a scary thought because the doctor probably isn't the one starting the IV. They're probably not the one ordering the products. They're not the hospitals. So to just assume that, I mean, I would really question, like, well, again, are the training? Are they doing, revised training? How did they learn about this stuff?
Right.
Do they understand what they're using? To me, that is where we should be focusing on.
And I think one of the interesting things and surprising things about today is you're going to meet some physicians who you already know, but some of the viewers may not. There are physicians who spend their education, time, career learning all the science on all of this stuff and HRT, regen, IV hydration, all of these therapies and all of these wellness-based solutions. That's what they're seriously invested in from an education science perspective. And these physicians, that's what they do every day. So the idea that there's physicians over here who aren't supervising RNs or APRNs or PAs,
yep.
And there are RNs, PAs, and APRNs over here not communicating, not interacting, is an absolute misunderstanding. And I hope through events like this, we can help correct that. But just by licensure, RNs, APRNs, PAs, they are interacting with physicians, supervising physicians all the time.
Yes.
And the physicians are many physicians. In fact, on an increasing basis, I've seen an explosion of physician direct involvement in the wellness space. They've seen the benefits of HRT or regen or IV hydration, and they're fully committed to it, and they do it very carefully, and they do it very methodically. They don't just jump in and hope, hey, I went to a weekend conference and I think I can figure this out.
Well, it's what they went to school for. Like if I say this all the time, nurses and medical professionals, all of them went to help people. That was the main thing they went for. Yeah. They went to help people. And when they get a little taste of like, wow, like that mom who's 40 years old working doesn't have anxiety anymore and loves her husband again and wants to go out and hang out with her kids, like, wow, that's pretty cool. Like they're like, can I do that again? And then it happens again. And then it happens again and it happens again. And they start realizing, wow, this quality of life thing, giving somebody their life back is a little bit more rewarding than the I'm sick. I need intervention right now. And so there's a place for all of it. Medicine is so broad and we need all of it. But I think to your point of, we just need a doctor in a store. I'll tell you guys right now that as a nurse, there would be a provider that I could find that would start an IV clinic that would ask me every question because they wouldn't have the education. It's just like having a maternity doctor go do plastic surgery today. That would never happen. Right? You have to understand that we have a scope of practice. And yes, our state gave us a license. But again, doing like, could we? Yes. Should we? No. Like that is the biggest thing is we should be focusing more on the client safety aspect, the training aspect, making sure that these are clean, the products are coming from where they should come, like reliable sources. These are the things we need to focus on, because if we're just going to try to follow that theory, I assure you there'll probably be way more worse implications
Yeah.
than what we're trying to do here, because we really are building that standard and utilizing all of the data from all of these clinics and finding the best ways to, have that workflow for all these clinics can be safe.
One of the things you mentioned was the products that are used. I think we're all watching in many of the states this question and a little bit of confusion of the blending of clinic and pharmacy. Like maybe clinics should be treated as pharmacies. Maybe the Board of Pharmacy regs should apply to these clinics. Maybe they should all have laminar hoods. Maybe they should, the provisions of 797, the US Pharmacopoeia, should apply to all of these clinics in exactly the same way that they apply to 503 pharmacies, compound pharmacies. Are you hearing that, and are you getting that kind of input and hearing those kinds of things in your industry?
100%.
Yeah.
I mean, and there's a validity to it. If I call the nursing board or the pharmacy board today in my state, they will tell me, is it within your scope of practice? I'll say, yes. I'm asking you, is it in my scope of practice? Well, that's for you to decipher. That doesn't help. That we need to be more clear about this stuff. Let's help them be safe. Let's not make it a guessing game.
Yeah.
Like, if you want me to have a hood, tell me to have a hood. If you want me to do this, tell me to do this. Now, at the end of the day, we have a great group of people with a lot of data. We all do it a little bit differently, safe. We all have really great outcomes, but to help put together what that standard is so that everyone else can see, like, wow, out of all these people who have been doing it for 10 plus years or 20 plus years, that will give these nursing boards, I hope, like an outline to help them look at that. However, I go back again to an ICU, or I go back to these other surgical, experiences I've had that I'm pushing 3 or 4 things, or I'm, giving medications, or there's 7 drips. There was a Davis drug guide I had to go through and make sure, are they all safe? Do you know how many times doctors have come in and said, hey, I'm going to order this. And I'm like, oh, they can't order that because of this. There is that communication, there is that glue still. And I think it's really important to kind of put it back when we make these. If we're going to try to do something like that, the implications it's going to have, not just on our industry, but your surgery centers. I live in Nebraska. Do you know how many small clinics there are in the middle of cornfields, you guys? What we're going to say that you can't now push a medication in a code situation? Like, the implications of what we're trying to do is significant, and the domino effect of what it could happen is taking 10 steps backwards, in my opinion.
Yeah.
So I would rather work with our regulators to really help them understand what we're doing and doing it in a safe manner. But again, going back to where you get them, I'm not getting a bag of vitamin C and creating these things. I'm going to a very well-known pharmacy
We're going
who
to dance
spends
pharmacy.
thousands and millions of dollars making sure that I can have a
Yeah.
multi-use vial, which if you're now going to tell me a nurse can't use a multi-use vial, it's going to be a lot of surgery centers and a lot of doctors' offices that it's going to have a lot more issues. So going back down to what we're trying to, regulate, which I do believe comes from fear and the wanting to be safe. I think let's look at, like, what are the actual clinical implications of, like, what has happened in these stores before we make these really line in the sand kind of decisions.
That's a great point, because really, if we do things the way we're working to do them with the Scientific Advisory Board and AIVA, what we're doing is we're really sharpening our pencil, and we're sharpening the tool of the regulators and sharpening the articles of the media. We're helping them dial it in, because there's a difference between IV hydration and mesotherapy, because there's a difference between a pharmacy and an IV clinic, because there's a difference between a physician who spends his time removing gallbladders and a physician that, like Dr. Davis, is absolutely committed to the wellness and functional medicine space.
100%.
These are very, very different things, and you can't paint a solution with such a broad brush.
Correct.
Speaking of which, I wanted to talk about, just for a minute, the notion of licensure. There's a conversation in the background that, well, gosh, maybe these clinics should be separately licensed. We should come up in our state, whatever state, with a separate licensure statute, and we should fund a whole bunch of regulatory enforcement people, and they should be separately regulated.
Mhm.
Even though every clinician in every clinic is licensed, every one. Every RN is licensed, every PA is licensed, every APRN is licensed, every MD or DO is licensed, every paramedic is licensed.
Yes.
And every one of them is also what? Insured. They're all insured. So you have this stacked insurance as well in these clinics. And I think that's something that's a little bit missing from the conversation at the regulatory and policy making level, is when you're talking about licensure, it's based on the notion that something isn't licensed and it'll be better if it is licensed.
Right.
That's an understandable perspective, especially in the healthcare space.
Right.
And yet every clinician that's working there, licensed. Every clinician that's working there, insured. Every mid-level practitioner that is working in these has a supervising or collaborating physician whose butt is on the line because they file a supervising document with the Board of Nursing or the Board of Medicine. These are things that, and conversations and talking points that are important when we're looking at what? More effective regulation, more effective legislation, identifying the problem and solving the problem that really is, not the problem that's imagined.
Right.
You know, there's an old saying, there are a couple things in life you don't want to see being made. One is sausage and the other is law. You don't want to see that. And by that, I mean this. I remember when I worked with the lobbying team on the FMA many, many years ago, and have since been involved in a number of lobbying endeavors and lobbying organizations. That's a very collaborative process where the stakeholders get around the table and have very productive, very interactive, sometimes a little bit contentious conversations. So you can identify the problem and then come up with the best way, the best solution to hit those problems. The problem for any emerging industry, including IV hydration, is they're not at the table. They don't have a seat at the table. So what we're doing, instead of inserting ourselves into that process as a lobbying organization and saying, we deserve to have a seat at your table, we're going to sit at your table. All we're doing is saying, we're going to talk to you about anything that concerns you. You want to talk about pharmacy stuff? We'll put you in touch with Dan from Olympia. You want to talk about functional medicine and physicians and how they think and what their issues are? We're going to put you in touch with Dr. Davis. You want to talk about clinics, what's happening there? We're going to put you in touch with Felicia. We're going to put you in touch with Sammy. We're going to put you in touch with everybody who's identified as a respected leader in this space. You want to talk about information and the fact that one of the criticisms is that this is so anecdotal. I feel better. Well, that's not enough. We're going to put you in touch with Sarah and Revive. Why? They've collected data for years. They have the information. They have the analytics. They have information that validates not just I feel better, but I am better. Moving the needle is an important part of a regulatory function, right? Moving the needle and putting the transparency on this process and on wellness and on any emerging industry is the responsibility of the media. We respect it, we support it, and we're there to make their job better and help them get a better outcome. And I think that's one of the key messages we want to communicate today and that we're sincerely committed to. So talk about a little bit of that from your perspective. Any part of that. Sorry.
That's a big part.
It's a mouthful.
But,
Yeah.
You know, I will be very transparent. So within LIV, we are in roughly 19 different states. And so I understand that what I do in Nebraska is different than Florida, so forth. And I respect it, because the reason I truly believe that these regulations have come up is because there was harm done, something was put in place, and they want to neglect more harm.
Yeah.
So I respect it. And I respect the staff that is in there that worked very hard and paid a lot of money for that license. So like you said, having these different professionals licensed is different than where people sometimes think, you know, a surgery center or a hospital has an audit, right? Or they have a, we're going to have somebody come in and check to make sure that they are, you know, classified. Well, they're getting funding from somewhere that is allowing them that those people need to make sure that they're doing what they say they're doing because they're getting money. So there's a little bit of a different thing if you just had a primary care provider that doesn't take insurance, that is doing a concierge, very well established, great physician, they don't have all those people coming in to check. So going back to what you said, making sure that we're going down to a different level, right? You can have someone and make a place look like they're in regulation for a day. But when you have humans who are all individually trained, working together, making sure that each nurse is accountable for that patient's safety and working as a team and working with the provider, and all of your individual license are at stake with your team, to me, that is a recipe for success, because all of us are working together, to making sure that it is a safe place, not only for the clients, but for their license and protecting them.
Yep.
So I think that's, an important thing to say, but also just knowing that it is vastly different from state to state. So when we're talking about it, and what we want to do is to be able to show overall, that this can be a nationwide policy. This can work anywhere. We care about what happens in Alabama and South Carolina and Nebraska, and we can look at the actual events and help make sure that our processes are also going to help neglect that. Because, having these high advanced practitioners in a place that they're the only ones that can administer, when you have spent thousands of dollars on these amazing registered nurses and paramedics and all these people that can do these acts, it, to me, is a waste of resources, and it's going to cause a problem on the healthcare system. I mean, everyone knows that 2020, caused a little bit of rock the boat. We do not have enough providers. So then to start trying to restrict them in, this industry and this industry, I think would be a terrible decision.
Yeah. Well, this is a good start. Thank you so much.
You're welcome.
Great conversation. We're hoping to shed some light, not so much for the folks that are in the room, but the folks that aren't in the room, on some of the issues and some of the ways these business leaders and clinical leaders think about these issues, so that we can stimulate better conversations and have a great interaction with you that helps your outcomes be even better. So thank you so much.